Welcome to Type 2. On this channel, we're going to discuss some things that I consider important to know if you're dealing with Type 2 diabetes. My name is Vladimir and I'm an endocrinologist. What I will try to do with these videos is explain to you the pathophysiology of Type 2 diabetes in a way that everyone can understand, and hopefully that can help you make better decisions if you're dealing with Type 2 diabetes, of course. Now, for this first video, we'll compare Type 2 diabetes with Type 1 and see what we're dealing with. Now, let's say that you eat every day, right? You probably eat every day. Then why do we need to eat every day and many times a day? Now, because the way you're looking at me now, I look like one person. Well, I'm actually one person, but what I mean is I look like one piece, right? It's not. I'm actually a bunch of cells put together with some precise engineering that I look like one. I am one, actually. We have different organs with different cells doing different work. Now that I'm talking to you, my brain cells are very active, hopefully. Otherwise, you will. Anyways, my heart is busy pumping blood here and there. The cells in my kidneys are busy filtering the blood. The pancreas, beta cells, for example, might be busy producing insulin and stuff like that. And for them to work 24/7, every day, every minute, every second, they need energy. And where does this energy come from? It comes from the food we eat. And it goes to different cells in our body so that they can function. They can do different things that they're supposed to do. Now, sometimes when we tell patients that they have high blood sugar, they take it like, some of them make it sound like glucose is some evil thing that just dropped into your bloodstream out of nowhere. Just talking about glucose, my blood sugar, my A1C, this and that. But we need to understand that glucose is always in your bloodstream. Glucose is always there because it's coming from the food that you eat, going to different cells. Let's say this is the food that you eat, and then it comes not just glucose. Glucose, it may be fatty acids and amino acids and many other things can come. Now later we can talk about the other ones because they also play a role in this process. But let's say that you take glucose from the food, right? And then this glucose has to go to different places in our body to produce energy. For example, you have this place. Let's imagine that this is a city and there are different cars on the road going to different places. And for them to know when they should go straight or turn left or turn right, they need to have some signals. And we have traffic lights, different traffic lights on the road, so that they can signal the cars when they should go straight, when they should turn left, when they should turn right. Now, the same thing is happening in our body. We also have traffic lights, and the traffic lights are beta cells of the pancreas. Inside your pancreas, there are some cluster of cells called islets. And inside the islets, we have some cells called beta cells. Let's take one outside. And they produce insulin. They produce insulin. And insulin is actually the one that directs the glucose to different places. To tell the glucose, you should go straight. Oh, sorry, not a car. To tell the glucose if they should go straight and be used as energy, or if they should turn left and be stored as glycogen. Or if they should also turn right and be stored as fat. So the same thing is happening in our body. Now let's imagine that there's a traffic jam here. There's a traffic jam here. There are too many cars. What do you think that could be the problem? There are three things that we need to look at. The first one is if the traffic lights are working. If they're not working, let's say they all turn red, these cars will just stop here and not go anywhere. Now the second one is how many cars are coming here. The third one, how many cars are leaving. Very easy. Now, if the traffic lights are not working, we just replace them. And this is the pathophysiology of type 1 diabetes. Because when it comes to type 1 diabetes, the traffic lights, in our case, the insulin, the beta cells that produce insulin are destroyed by your immune system by mistake, which means that these patients do not produce any insulin. So we need to replace it. That's why everyone with type 1 diabetes, no matter where you're from, if you're tall, short, white, black, green, you will always have to take insulin. This is number one reason why you see all the patients with type 1 diabetes taking insulin. Simply because they do not have the traffic lights, they do not have the beta cells that produce insulin, and we need to replace the insulin. Very easy to understand. But those people, their lives are not easy because beta cells are very highly sophisticated cells. They work really well, and we can never match that. However, it's easy to understand. No traffic lights. We put the traffic lights back, even if it's a bad one, but we still put the traffic lights back, and they keep going with their lives. So now that we have type 1 diabetes out of the way, we look at type 2. Now, for type 2 diabetes, most of the patients with type 2 diabetes still produce insulin, still have functional islets, and with enough beta cells to produce enough insulin that someone would need. However, the amount of glucose that is coming into the blood is more than the glucose that is leaving the blood. Now, this has to happen for a long time. That's why most people with type 2 diabetes, more than 80%, are obese or overweight, simply because there's more glucose coming into the blood than the glucose that is leaving. This has to happen for a long time, because if it's just for a day or two or a week or a month, even 1 year, we have backup. We can store the glucose somewhere. We can store them in other places. But eventually, we will run out of place to store them, and they will stay in the blood. This is why when it comes to type 1 diabetes, we have one way to deal with it. Replace the insulin that is missing. Now, for type 2 diabetes, you hear a lot of things. You hear people talking about fasting, right? With this understanding, what do you think they're trying to accomplish? Reducing the glucose that is coming. Easy. Do you think it's going to work? Do you think fasting, for example, will work? Of course it will work. However, getting patients to fast is another story, right? We'll talk about that later. Now, others talk about low-carb diet. What are they trying to accomplish? Less glucose coming into your bloodstream. Some will talk about keto diet. Keto. Sounds cool. But what it means is just less glucose coming into your bloodstream. Because that diet has almost no sugar and no carbs. Maybe, I don't know, 5, 10, 20%. So what they're trying to accomplish is just less glucose coming into your blood. Now, I can do that. I can invent a diet right now. I would call it a stone diet. A stone diet, right? A diet that you eat stone and you drink water. Do you think it's going to help you with your type 2 diabetes? Of course. Stone has no sugar, less glucose coming than the glucose that is leaving. But the stones will kill you though. So don't try this at home. Don't try this at home. That's why even the drug companies, pharmaceutical companies, try to tackle this problem. Now, we know drugs like metformin, right? First-line therapy for type 2 diabetes. Do you know what metformin does? One of the things that metformin does is decreasing your glucose absorption. So less glucose will be coming here into your blood if you take metformin. Even the glucose that should be produced by the liver, metformin, let's say your liver is trying to produce some glucose. Metformin will reduce it. It also increases insulin sensitivity and some other stuff. But what metformin is trying to accomplish is having less glucose coming here and more glucose going by, for example, increasing insulin sensitivity. Okay, let me think about another drug. There is one called, the name is long, so I think I need to write it. It's called alpha glucosidase inhibitors. I don't know if you can see it. Alpha glucosidase inhibitors. Do you know what drugs like alpha glucosidase inhibitors do? Drugs like acarbose. When you eat food with a lot of carbs, they're mostly complex carbs. And inside your small intestine, there are some enzymes that will break them down into simple carbs so that your body can absorb them. Now, what these drugs will do, they will block those enzymes. So even though you eat 2 pieces of pizza, only one is getting into your bloodstream. Because these drugs can block those enzymes in your GI tract that are supposed to break the complex carbs into simple carbs so that the body can absorb them. By blocking them, only few of them will be working and less glucose will be getting into your blood. So why am I telling you all this? Because I believe that if you know what's going on, you will be able to make better decisions. For example, in this case of alpha glucosidase, instead of eating 2 pieces of pizza, you can change this one to vegetables. That will lower the sugar in that food, and it will also decrease the absorption of glucose. It will have almost the same effect of this one, but with no side effects, without buying the drugs, and this will probably be cheaper. So if I give you these 2 options, someone might think, oh, of course I'll take this one. But some other patients might say, wait, are you saying that if I have this drug, this glucose something, I can keep eating my carbs, all my rice and things that I love, and I don't need to worry about blood sugar too much? And we'll go like, kind of. And they go like, that's what I want. But at least you know what you're doing, right? What I think is not right is if I just tell you, okay, take these drugs, they will help you with blood sugar, but I don't tell you how. But after you know how, you will make your decisions. Now, let me give another example. We have a drug called SGLT2. SGLT2 inhibitors, also inhibitors. Do you know how they work? Your kidneys, the way they filter blood, they let everything go out and then they pick what they need. There is a transporter of glucose that will reabsorb the glucose into your bloodstream, back to your bloodstream. And these drugs will block them. So less glucose will be taken back into your blood. More of them will go to your urine. At the end of the day, there will be less glucose coming into your bloodstream and more glucose going to your urine in this case. There are many examples, but I just want you to understand the idea behind all these things. When you have your own understanding, you can make better decisions. I had 2 patients that used to work in the same lab, and one took this option, the other one took this option, and they both controlled their blood sugar. This one was happy because the blood sugar went down with no drugs, but she had to change something. This other one didn't change anything, but added some drugs, but continued with her happy life. So at the end of the day, I'm not saying one is better than the other. I'm just saying that you should know what is going on and choose wisely. That's why many people say that type 2 diabetes is possible to be reversed. It's possible to be cured, but not type 1 diabetes. And the idea behind that is that if we fix this issue of more glucose coming than glucose going for a long time, we can actually get the body back to normal. But there's one thing that we need to look at first, is the state of your beta cells of the pancreas. Even though I told you that for type 2 diabetes, most of the patients still have beta cells functioning, some patients do not have a lot of beta cells. Especially at the end of type 2 diabetes, the beta cells will be mostly destroyed. And for these patients, they will be almost like type 1. But normally, if you are in the beginning or middle stage of type 2, you probably have enough beta cells. And if you are thinking about reversing your type 2 diabetes, you need to check the function of your islets, if they're still functioning, if the beta cells are still okay. If they're okay, it's possible. If they're not okay, you'll probably need some help. That's why some patients with type 2 diabetes take insulin, but not all the patients. Patients with type 2 diabetes that still have functional beta cells should not take insulin unless there are some specific cases that we will discuss on other videos. No matter what you do, you can't let all this sugar stay in your blood because they will lead to all sorts of complications that we'll talk about when we talk about complications of high blood sugar. I think maybe I should just stop here and make another video next week because I think it's going too long. I'll probably talk about insulin resistance. Thank you so much for staying this long, and I'll probably see you next week when I make other videos. I will make videos on everything related to type 2 diabetes. Have a blessed week. Bye.